continue to talk about the contributors to caregiver stress. And if you see this PDF file, physical distancing, isolation is one main contributor to caregiver stress. It seems that it's more severe in more individualistic countries, spending less time with family and friends. And worry that the person they are caring for is going to pass away is another main contributor of stress. So, as you can see, caregiver stress is a big topic. There are many aspects to caregiver stress, things we may or may not realize. And oftentimes, caregivers, they are not paid. They spend their own resources to care for the people. Whether they are related, usually they are related to these people. And I think the majority of respondents from this survey, they come from people caring for family members, not institutionalized care. And inadequate government services support system is another contributor to caregiver stress. And they have to reduce their work hours, reduce pay related to financial stress. And same here. They are spending more money for the key necessities of the people they are caring for, like food, medical equipment, PPE, household bills. And many countries, even countries with a nationalized healthcare system, they don't really compensate caregivers. Or it seems that when they do their tax return, they may not get a big refund for being a caregiver. It seems that the people they are caring for may not count as dependents in most of these countries. So they are spending all this money on basic necessities like food, medicine, other bills. And caregiving is very taxing. And let me go off a tangent. My niece, when she was around 2 to 3, my brother, he works in IT, and sometimes he works from home. Essentially, he works from home all the time. And he's doing data work for the company. And even if that was the case, he sent my niece to his mother-in-law. He was caring for a young child, and his wife was a full-time nurse with a career, and she was busy too. So my point is, even if the caregiver has the option to work remotely, it is almost impossible to care for a person and work at the same time. Have their laptops right beside the bed or wheelchair of the person. Oftentimes, it doesn't work that way. It affects their career. And because they are constantly worried about the people they are caring for, we see from the previous slides, they worry that the people they care for may die if the person is close to them, related to them, a member of the family. If the person is a cancer patient, they are worried that the person may die one day. Obviously, they will be sleep deprived and they may not exercise as much because they have to always be with the person. They cannot leave the person. So all these has health implications. These can affect a person's mental state. These may develop into psychiatric problems if they have been caring for the person for decades, for years. And this also has health implications. And sometimes, if the caregiver postpone their own healthcare because of conflicting demands and schedule, their health condition may worsen. Not easy being a caregiver. It takes a toll on people's physical health and also mental health. So they cannot go hang out with their friends or other members of the family. So because of that, they are isolated. It affects their mental state. And this happens more so in highly patriarchal countries. And it's not possible to have a hand on a cell phone, another hand attending to the person they're caring for. Because of that, they often feel isolated. Can you see that? And usually, female caregivers are more likely to be affected emotionally. Because when we talk about biological sex, men and women are affected differently. And young caregivers, if they are first timers, they want more guidance and support. And middle-aged caregivers, they are often sandwiched between caring for their own children and caring for their older parents. So they all encounter different kinds of strain and stress, as you can see from the findings. And I think not only older caregivers, I think all caregivers, regardless of gender or sex or age, they all need more support. And this is a no-brainer. If you care for somebody with cancer, final stages of cancer, it's going to take a toll on your health. And oftentimes, caring for somebody with final stage of cancer, the person maybe cannot eat properly, sometimes cannot even drink, or sometimes cannot eat solid food, but can still drink. Or in most instances, the person is incoherent cancer patient. And because of that, this is very taxing on the mental health of the caregiver, regardless of age, sex, gender, or whatnot. And as you can see, not all caregivers are alike. Some are women, they have different needs and priorities. Some are young, they need more guidance. Some are middle ages, they are sandwiched between caring for two generations. Some are older, they have health issues themselves. They have other challenges themselves. And some care for cancer patients, which is also very taxing. And all these different types of caregivers have different needs and priorities. We cannot lump them all under a big umbrella. They are very diverse, as you can see. And I don't know if this is due to gender-based stereotypes. Women are more likely to report mental health implications of caregiving. As you can see, for all countries, the percentages of women reporting mental health issues are higher than men. And my 2 cents is that I think it affects the mental state of men as well. Maybe because of the societal expectations, like what you learn in Intro to Sociology, gender-based stereotypes. Maybe men experience emotional stress to the same extent as women. It could be true, but maybe they are more likely to give socially desirable answers because of the gender-based stereotypes. They are less likely to say they have emotional or mental health issues because of caregiving. And in certain countries, even still in some Western countries, another reason could be that women, because of gender role expectations, more women, in most instances, women are still expected to care for somebody in their family who is sick, who has a disability, who has cancer, and whatnot. So, 2 reasons I can think of why there's a higher percentages of women reporting mental health problems. And it seems that relatedly, women have more demands. They report that they are more likely to report that they need more support, they need more services, they need more resources and whatnot. These can also due to gender-based stereotypes. And young caregivers, they need more guidance, especially if they are first timers. And young caregivers are more likely to use technology as part of their caregiving. Maybe they tended to be more tech savvy, who knows? They are more likely to use e-health, telemedicine, among other things. And maybe they are more likely to use the pill case with different sensor that reminds the person when to take their medicines, how much they've taken, how frequent they should take it. Young caregivers are more adept at doing that. And middle-aged caregivers are more likely to be sandwiched between caring for their own kids and caring for their elderly parents. As you can see, young and middle-aged caregivers, they face different challenges. And older caregivers, nowadays, caregivers can be 50 and over. People live way longer because of advancement in medicine. New prescriptive drugs that can prolong their life, even though they have multiple chronic conditions. And these older caregivers, they may have health issues themselves, and they still have to care for maybe their older parents or relatives who are in their 80s and 90s. It's very, very, very taxing. And cancer caregivers, caregivers who care for cancer patients, they often need more support, more resources, more guidance. And it's hard to say which type of caregivers face the most stress their priorities differ, and the nature and type of their stress encountered by the different types of caregivers differ. We are just comparing apples and oranges. There's no way we cannot rank which type of caregivers is the most stressful. I don't think you can do that. And only 84% of those who care for cancer patients receive some help from private companies. And 77% of cancer caregivers receive assistance from non-profits. And 71% of these caregivers receive some compensation from insurance companies. 73% of these caregivers receive some support from their state and local governments. And 73% of these caregivers receive some help from their own communities. And regardless of the type of caregivers, everybody is concerned about COVID. And oftentimes, I think all types of caregivers have unmet need for food, for technology, for more support, for more subsidies, for more resources. These are all their unmet needs. And I think all types of caregivers have problems balancing work and caregiving and other responsibilities. And they feel invisible or underappreciated. So more support is needed for all kinds of caregivers. They are often between 30 and 50s. Some are older than that. And caregivers don't like reopenings. If there's no social distancing, there's no preventive measures that come with these reopenings, they don't like it. It increases their burden. And they are afraid of infection risk on the person they are caring for. It increases their burden. If the person they are caring for has COVID, it's more work for them. And they are also maybe afraid that they themselves got infected. It seems that the concern is higher for patriarchal countries like Brazil and India. And they face problems in terms of access to facilities for those they're caring for, affording healthcare for those they're caring for. They face employment pressures even if they work remotely. They juggle multiple responsibilities. They need to learn new technologies, new gadgets. It can be challenging for some. And sometimes they are not compensated for all these technologies. They are not reimbursed by the insurance company or by the persons they care for, insurance company.